Mental health issues have become one of the most pressing concerns globally, affecting millions of people across all age groups, genders, cultures, and socioeconomic backgrounds. The complexities surrounding mental health have only grown in recent years, exacerbated by modern-day stressors, societal expectations, and global events. From anxiety and depression to more severe conditions like schizophrenia and bipolar disorder, mental health disorders are a growing global crisis that demand attention. According to the World Health Organization, WHO, around 450 million people worldwide suffer from some form of mental or neurological disorder. This makes mental illness one of the leading causes of ill health and disability across the globe. As one of the most prevalent mental health issues, depression affects more than 264 million people globally. Depression often coexists with other conditions like anxiety, substance abuse, and physical illnesses, making it harder to treat and manage. Anxiety disorders, including generalized anxiety disorder, GAD, panic disorder, and phobias, are some of the most common mental health conditions. In a fast-paced, highly connected world, anxiety levels have skyrocketed, affecting more than 275 million people. The relationship between mental health and substance abuse is cyclical. Many people with mental health issues turn to drugs or alcohol as a coping mechanism, leading to addiction. Approximately 1 million people worldwide have substance use disorders, with an increasing number tied to opioid use. Tragically, the ultimate consequence of untreated or severe mental health issues can be suicide. Every year, close to 800,000 people die by suicide, which is one of the leading causes of death among people aged 15 to 29 years. The causes of mental health issues are varied and often multifaceted. Biological, psychological, and environmental factors all play a role in the development of mental health disorders. Some key factors include: a family history of mental illness can increase the risk of developing a mental health disorder. Chemical imbalances in the brain and hormonal changes can affect mood, anxiety levels, and cognitive function. Chronic physical health conditions, such as diabetes or heart disease, can also contribute to mental health problems. Trauma, abuse, and neglect during childhood can lead to a variety of mental health issues in adulthood, including post-traumatic stress disorder, PTSD, and depression. Low self-esteem, body image issues, and perfectionism are also linked to anxiety and depressive disorders. Poverty, unemployment, and homelessness are significant stressors that can exacerbate mental health conditions. Exposure to violence, conflict, and natural disasters can trigger long-term mental health problems like PTSD and depression. Inadequate social support and loneliness are known to contribute to the development of anxiety and depressive disorders. Modern society, with its emphasis on productivity, competition, and social comparison, has also contributed to the global rise in mental health issues. Here are some ways in which modern life impacts mental well-being. The pervasive use of social media has heightened feelings of inadequacy, self-doubt, and social isolation, particularly among younger generations. Constant exposure to curated, idealized versions of other people's lives can lead to distorted self-perception and increased anxiety. The pressure to perform, meet deadlines, and stay competitive has led to increased rates of burnout and stress-related disorders. The always-on culture, exacerbated by smartphones and remote working, has blurred the lines between personal and professional life, making it difficult for people to relax and disconnect. Global events like pandemics, climate change, wars, and economic recessions have created a climate of fear, uncertainty, and stress. The COVID-19 pandemic, in particular, triggered a mental health crisis, with many people experiencing heightened levels of anxiety, depression, and loneliness due to lockdowns, isolation, and the fear of infection. While mental health is a global issue, its impact is felt most acutely in developing nations. In many low- and middle-income countries, mental health services are severely underfunded or non-existent, leaving millions of people without access to care. The stigma surrounding mental illness is also more pronounced in certain regions, where it is often viewed as a personal weakness rather than a legitimate medical condition. Lack of access to mental health care in these areas is compounded by poverty, violence, and displacement due to war or environmental disasters. Many people in developing countries struggle to meet basic needs like food, shelter, and safety, leaving mental health issues unaddressed. Additionally, traditional beliefs and practices sometimes clash with modern mental health care, further complicating treatment efforts. Despite the growing awareness of mental health issues, stigma remains one of the most significant barriers to treatment. Many people still perceive mental health disorders as a sign of weakness or failure. This stigma prevents individuals from seeking help, fearing that they will be judged, marginalized, or labeled as crazy. In some cultures, mental illness is seen as a spiritual or moral failing, leading to shame for both the individual and their family. This can prevent people from reaching out for professional help, as they may turn to religious or traditional healers instead. Mental health conditions are still stigmatized in many workplaces, with employees fearing that they will be viewed as unreliable or less competent if they disclose their struggles. This stigma creates a barrier to accessing necessary accommodations and support at work. In recent years, governments, nonprofits, and international organizations have recognized the urgent need for mental health care reform and support systems. Initiatives aimed at increasing awareness, reducing stigma, and providing accessible care have begun to emerge, especially in high-income countries. Some of these initiatives include global awareness campaigns such as World Mental Health Day, observed on October 10, aim to educate the public and reduce the stigma surrounding mental health disorders. These campaigns encourage open discussions about mental health and promote help-seeking behavior. Many organizations are now incorporating mental health support into their employee wellness programs, offering counseling services, stress management workshops, and mental health days to support their workforce. The advent of telemedicine has expanded access to mental health care, especially in areas where in-person services are limited. Mental health apps and online therapy platforms are providing individuals with tools to manage their mental well-being from the comfort of their homes. In low-resource settings, community-based mental health programs are becoming increasingly popular. These programs focus on training local health workers to provide basic mental health care and support, allowing more people to access services in remote or underserved areas. In addition to clinical treatment, faith and spirituality play a critical role in many individuals' mental health journeys. For people of faith, prayer, meditation, and spiritual guidance can provide comfort, hope, and a sense of purpose during difficult times. Many faith communities offer pastoral counseling and support groups for individuals struggling with mental health issues, creating a sense of belonging and healing. While spiritual practices are not a substitute for medical treatment, they can complement traditional therapies and offer a holistic approach to mental well-being. Faith-based mental health interventions, which combine clinical care with spiritual support, are becoming more common, especially in areas where mental health resources are scarce. To effectively address the global mental health crisis, coordinated efforts from governments, health organizations, and communities are essential. Key actions include: governments and international organizations must prioritize mental health funding, especially in developing nations where resources are limited. Adequate funding is needed to train mental health professionals, build infrastructure, and provide medications. Reducing stigma through education is crucial. Schools, workplaces, and communities should be educated about mental health issues to foster a more inclusive and supportive environment for those affected. Mental health services must be made more accessible and affordable, especially for vulnerable populations. Telehealth, community-based programs, and mobile clinics can help bridge the gap in care. Mental health should be integrated into general health care systems, ensuring that people can receive comprehensive care for both their physical and mental well-being. Mental health is a global issue that touches every corner of society. By fostering understanding, compassion, and a commitment to accessible care, we can work toward a future where mental health is a priority for all. Mental health issues are undeniably one of the most significant global challenges of our time. They affect people across all walks of life, with no regard for socioeconomic status, geography, or age. The prevalence of mental health disorders, from anxiety and depression to more severe conditions like schizophrenia and bipolar disorder, continues to rise, posing a considerable burden on individuals, families, and society as a whole. Addressing mental health is not just a medical or psychological issue but a complex societal concern. Biological, psychological, and environmental factors all contribute to mental health disorders, and each person's experience with mental illness is unique. The pervasive stigma surrounding mental health creates barriers to treatment, exacerbating suffering, and reducing the quality of life for those affected. This stigma is particularly pronounced in developing nations and certain cultural settings, where mental illness is still misunderstood or considered a personal failing. Modern life, with its constant pressures, technological advances, and social comparison culture, has only amplified mental health issues. The rise of social media has created new avenues for anxiety and self-doubt, while workplace demands and the always-on mentality have led to widespread burnout and stress-related disorders. Additionally, global crises such as the COVID-19 pandemic, political instability, and climate change have heightened the collective stress and anxiety experienced by societies worldwide. Despite the challenges, progress is being made. The global conversation around mental health is becoming louder, and efforts to raise awareness, reduce stigma, and expand access to care are beginning to take root. Governments, health organizations, and nonprofits are taking action, launching initiatives to promote mental health and integrate it into the broader healthcare system. Innovative solutions like mental health apps, telemedicine, and community-based interventions are helping to fill gaps in care, especially in underserved areas. For lasting change to occur, mental health must be treated with the same urgency and priority as physical health. This requires increased funding for mental health services, especially in low and middle-income countries, where resources are scarce. Education and awareness campaigns must continue to break down the stigma associated with mental illness, empowering individuals to seek help without fear of judgment. Furthermore, mental health care must be made accessible and affordable for all, ensuring that no one is left behind. Faith and spirituality also offer valuable tools in the fight for mental health. For many, these practices provide comfort, meaning, and community support in times of emotional and psychological distress. While clinical treatment is essential, integrating spiritual care into mental health practices can create a more holistic approach to healing, especially in areas where access to professional services is limited. Ultimately, the global mental health crisis demands a coordinated, multifaceted response that addresses the root causes, reduces stigma, and makes care accessible to all. The future of mental health care must be inclusive, holistic, and compassionate, ensuring that mental well-being is prioritized as a fundamental human right. By working together across sectors and communities, we can create a world where mental health is not only supported but celebrated as a vital part of human flourishing.